15 things you need to know about a dental implant. My name is Ramsey, Amin, DDS. I practice in Burbank, California. And I'm going to go through some of the real basics. I'm going to keep this kind of a little bit superficial just so you kind of get some info if you're new to the topic. Well, first off, what is a dental implant? It's an artificial tooth root. It replaces a missing tooth. It's strictly just a root. It's a titanium screw, essentially, that goes into the bone, surgically inserted, and a crown could be made on it, a bridge could be made on it, a denture could be snapped onto it. It can be reused and repurposed for different things. But it's essentially a root that goes into the jawbone, deeper where the roots are. Who is a good candidate for a dental implant? That's the second question. Is basically if you're healthy and you're between the ages that you're not too young and honestly not too old. About 100 is my oldest patient, and youngest maybe 16 to 18, ideally a little bit older than that. You're a good candidate if you're healthy, don't have any autoimmune disease, you haven't received radiation to your jaw, you don't have severe uncontrolled diabetes, drug and alcohol problems can be an issue. So basically a healthy patient that can get around, you can go up a flight of stairs, and you can take care of your implants as well, right? Just like you take care of your teeth, you have to take care of implants. It's not just put them in and then forget it. So basically, if you're healthy enough to have a tooth extracted, you're healthy enough to have an implant. Of course, some people need one implant and some people need 12 implants. And that's a different level of care as well. Third question, what are the advantages of dental implants? I know I can go on forever on this one. Mainly it's going to restore, it's going to give you back what you had before, right? If you're missing teeth, it can be a big, play a big role in your self-confidence, your ability to eat, embarrassing situations, and just keep your smile nice, healthy. It's a tremendous advantage for preventing shifting of teeth, preventing bone loss, preventing your face from shrinking over time. If you start missing many teeth, many patients end up losing like a back molar and then another molar, and then a few years later they don't have the back teeth to support, so they end up losing their front teeth. So the advantage is it restores your mouth and your teeth to original, or at least as close as possible. Nothing's like your original teeth. Dental implants are a close second place. If you can keep your teeth predictably, then by all means, that is the way to go. Disadvantage of dental implants is, well, it can be costly, right? It's a surgery. You have to have surgery. The gum has to be open for it to be put in. And it has some risk, right? It has some risk of bruising, swelling, bleeding, numbness. There's anesthesia that you have to go under or at least get numb. Most of the bigger procedures require sedation. But it's overall a very safe procedure. And a dental implant does not last forever. So please don't be fooled by misleading marketing that says it lasts forever. I'm going to go into that shortly. But just like anything else, a crown, a filling, there's risks to those procedures as well. And that would be some of the minor disadvantages of having implants. You have to keep them clean. Having dentures is easy. You don't have to do anything really. How painful is a procedure? I find a wide array of patients' pain responses to, at least when they come to me with past implant experiences. Most of my patients almost have no pain at all. I have a very special technique using blood plasma, IV sedation, some magic in the IV. Even my patients that go through full mouth implants, even cheekbone, are called Zygomatic implants, they hardly have any pain. They'll take, my average patient that has 1 or 2 implants will take ibuprofen or Tylenol afterwards. And that includes even if they had bone grafting. So pain, at least in my practice, is not a factor, although I do hear a lot of stories about people that couldn't get numb during the procedure, a lot of pain and swelling afterwards, prolonged healing, a bad smell. We'll go into a little bit about why that could happen, and really kind of segues into the next question. How do you find the right implant dentist? Do you go on Yelp? Do you go on Google? Sure, there's some of that social proof. My main thing is that you connect with the person that's treating you, that you guys like one another, have a mutual respect. And honestly, if they have credentials that have been validated externally, right? Not just, a dentist with graduated school, but do they have credentials, a board certification of some sort that has been reviewed by their peers as well, that have qualified them as a board certified implant specialist. And there's many different specialties in implants, from generalists to oral surgeons, periodontists. Myself, all I do is implant dentistry. But I can tell you is the one thing that's most important than anything else is nothing replaces experience. Right? Nothing, no sort of I graduated from this school or that school or whatever. Nothing replaces experience. I mean, I've placed about 17,000 implants. I can pivot on any procedure at any time. I've seen it all, done it all, seen all sorts of complications, both of the teeth-making side to surgeries to advanced bleeding. So finding the right dentist is going to depend on the type of procedures that you're having done. Do your due diligence. I encourage, second opinions, even with my own patients, to go out there and see that they're comparing apples to apples, because it's not something you just stick in the gum and go. There's so much that can go wrong, and there's a lot that needs to happen for it to go right. It's in my practice, a very planned procedure, kind of like blueprinted, and know exactly what's going to happen, especially as we get into bigger cases or front teeth. We want to know how things are going to look and feel before we ever start. Not just say, oh, here's your tooth, and that's what it looks and feels like, and it's a complete surprise. So experience, training, judgment, and skill, those are things that are really important in finding an implant dentist. And then finding a team, that the doctor has a team of people, lab support, assistants and nurses and anesthesiologists, etc., that have your care in mind as number one, that this is a routine procedure for them, not just something that's done every once in a while. I find some practices have traveling doctors and things, and that can work in some situations, but I prefer an implant dentist that's in one location all the time. But that's, again, my preference. That's what I do. I'm in a single location for 20 plus years now. How much do implants cost, and does insurance cover the cost? Insurance covers a little tiny bit if you have it. If you don't have it, it's not a big deal. It hasn't changed since 1975. Dental insurance maximums are approximately $1,500, capped at that point. That's the same cap that we had back in the mid-1970s. Has not changed at all. It should be in the $20,000 range by this point in the year 2023. It just has not kept up. Implant procedures from start to finish can be anywhere from $4,000 to $100,000. There's quite the range. Of course, if you need 10 teeth or double upper and lower, it's more costly than the upper, than just a single tooth. But again, my main thing is just do it right the first time. Even if you're going to pay a little bit more, that is the key. Revisions and redos are about 35% of my practice. Bargain shopping, I hate to tell you, but you get what you pay for. I see a lot of problems out there with implants just not done so well. There are some weeks I actually remove more implants than I put in, which is really kind of crazy. But I'm going to keep going here on number 8. What is the success rate of dental implants? In my own practice, it's about 98%, 99%. Nationally, probably 95, 90, somewhere in there. Depends how long you look at it for. Nothing is 100%. If anybody tells you they never had an implant fail before, they're completely lying to you, or they've only put in one implant. They've never placed more than a single implant, and they had that one worked. So, of course, I've had implants that did not work before. We simply replace them, take it out, put another one in. It's usually early on when it won't work out. But they tend to be a very successful procedure, as successful or even more successful than a root canal and crown would be over time at the 10-year mark. And so success rate's very high. Number 9, how long do dental implants last? I wish I could say it's your lifetime. Again, watch out for deception and lies, misleading advertising about that implants are going to last your whole life and you're never going to have any problem with them. That's not the case. As for a disadvantage of an implant is it can lose bone, it can lose tissue, just like my own teeth have lost a little bit of bone, a little bit of gum naturally with age. That will happen. So I consider success to be somewhere 15 to 20 years. I have plenty of patients that are at the 24-year mark with their implants that I've placed with no problems at all. Care, maintenance, x-rays, cleaning, having watchful eyes that actually know what they're doing and know what they're looking at is really important over time, to check the bite and to check the x-rays and to feel the gums, things you wouldn't sense at all. So how long do dental implants last? I would say ideally 10 to 20 years. Definitely can go a lot longer. There's a small subset of patients that can have problems in the 1 to 3 year mark. Again, do it right the first time. Nothing replaces experience. How long does it take? That's a wide variety. I can go on that topic for a long time. It's going to take somewhere between 1 day and 1 year. That's probably the typical. Full mouth, I can extract all the teeth, put all the implants in, all in a day, and you have teeth that fast in less than 24 hours. Or sometimes for a really complex single tooth in the front, it may take many stages and temporaries and building bone and building gum, and those can take several months to do. In my practice, you're never without a tooth, especially if it's in the front of the mouth, but it's a variety. I have many blog posts about how long does it take to get a better idea of it. Do I need a bone graft? Really common one. Having bone both adequately wide and adequately tall is an absolute necessity for an implant. You got to have enough bone for it to be put in. And even if you have just enough, it's still better to add, because typically over time that just enough is going to shrink a little bit more. So having more volume around the implant is always going to be better than less volume around the implant. So many cases, immediate take out a tooth, put an implant in, you have to reinforce, you have to graft a little bit. Full mouth implants, I'll often take the patient's bone, that's some extra bone, and recycle or repurpose their own bone back into there. We can use teeth as bone graft materials. We can use cow bone, human bone, synthetic bone. But do I need a bone graft? You really need to be evaluated very carefully to see if that's a necessity or not. But I would say it's very common to need a bone graft to support an implant. What's an all-on-4 or all-on-5 or all-on-6? That is our 12th question. It's a full mouth replacement. It replaces all teeth, which usually 4, 5, or 6 implants, and replace a whole arch as a horseshoe type of bridge that goes from full top and a full bottom. Typically happens in a single visit. Lots to know about this. I've got a lot of information on my website about this. This is something I do on a daily basis, full mouth replacement. That's only done when all the teeth have to go. There's really no other good options that we replace all the teeth with implants. That's what's referred to as all-on-4. You can use more than 4 implants. Having 4 is typically sufficient. In the upper jaw, we like to have a little bit more than 4 if possible on the upper jaw. And the 13th question is, can dentures be made into implants? Yes. If you have dentures, doesn't mean you can't have implants. It's just going to mean that we have to make sure you've got the adequate lip support and bite and build everything so that you have fixed teeth all the time. There are some snap-on options called overdentures. I'm not a big fan of those. Those are things from the past, to be quite honest, or in situations where maybe you're very elderly and just you have a denture that's really good, it just lost its hold, you just need a little bit extra. Some implants can be put in underneath. But dentures can be, even though if you have dentures, you're not stuck with dentures your whole life. You can have implants right away and teeth within 24 hours. And that is something that I do in my practice, like I said, regular basis. What type of teeth are best? Question 14. The best type of teeth, obviously the ones that fit your face, look good, feel good, function well. But for type of teeth in 2023, zirconia is the way to go. Titanium dental implants are still the good standard. They work, they don't have allergies, they're safe, and zirconia teeth are typically the best. They can be layered, made to look extremely natural. Some cases need to have some gum overlay put on, some pink, or bigger, more complex cases, but zirconia is by far the best material to make teeth with. Lastly, a question that comes up a lot in my practice are, what's a zygomatic implant and other specialty implants? If you don't have enough bone in the upper jaw typically, and we can't go through bone grafting for a number of reasons, zygomatic implants are implants that go into the cheekbone. They're about this long, and they go into the base of the cheekbone right here. They're not by your eye. They go into the cheekbone, and there's other types of implants called pterygoid implants that go back where the upper wisdom tooth used to be. There's some special bone back over there. And then there's other specialty implants called transnasal or vomer or piriform rim, basically that engage the bottom of the nose. These specialty implants, zygomatic, pterygoid, vomer, transnasal, all those are intended for patients that have really hollow bone. They have hollow sinuses. The upper jaw is soft and skinny, and they're used for these special cases where regular implants wouldn't function as well, or you'd have to have bone grafting done from your hip in order to replace enough bone to have implants in those areas. I use them quite commonly for many, many years now, and they can really provide an awesome solution for your whole mouth replacement, especially the upper jaw. So those are the top 15 questions to ask, to know or to ask or to know a little bit more about. And of course, find out the history of the dentist that you're working with. What's their experience? How many have they placed? What's the staff like? These are things that are really important. Don't just show up at any old place and just have this done. Do a little bit more research into it before you dive in. All right, I hope this is helpful. Sorry for the long video, but I wanted to make sure we covered all these topics. So take care. My name is Ramsey Amin, DDS, practice in Burbank, California, burbankdentalimplants.com. Thanks so much. Bye-bye.